I am Dave Johnson with the Employee Assistance Program, and today I'm here with my friend and colleague and coworker, Nurse Patrick Essex. And, Patrick, you and I chatted a little bit earlier this week, and I've been a nurse 40 some years, and I don't think I've ever felt a time in my career where I felt more pride in terms of being a nurse or being a social worker. And I know I've also felt a bit disconnected from the front line. I can cheer and I can provide some help maybe from the sideline, but I'm thankful to be here with you today to be able to chat about the front line. And I know you're a relatively new nurse. You've been nursing for almost a year.
I definitely never would have expected to be in the middle of a pandemic within my first year, but
Right.
it's been a wild ride.
And so I help coworkers and people within the community with this thing called mindfulness and stress. I'm an adult psych nurse. And mindfulness is the ability to pause and to be able to come out of the thinking and the overthinking and the worry brain and to be restored through sleep and through rest and through meditation. And the mind of the nurse, especially during a pandemic and taking care of COVID clients, has been anything but restful. So I wonder if you could reflect a little bit on that high level stress and perhaps how you kept your cool.
There's a lot of responsibility on your shoulders. So all of that in the midst of a pandemic, like you said, yes, it can be very, very, very stressful. And it can be very, very hard to hit that pause and take a moment to be like, all right, let's decompress or let's step away from the situation for sure. And I will admit that I'm not perfect at it by any means. It just takes a conscious effort to kind of reach that mindfulness. I think that through all of it, I don't know if I would have been able to get through it without like the coworkers that I actually work with. We're a really, really strong support for each other. I personally work at the medical ICU at PRMC, Parkview Regional Medical, of course. And that's really become essentially like a COVID hotspot through all of this. If somebody has COVID and they're really, really, really ill with it, we're going to see them on my unit. And I mean, I've always prided since the day I started my unit and the way we work together, our teamwork, our cohesiveness, the way we got each other's backs. And there's no way we could have gotten to where we are or continue to do the work that we do without the support of each other.
I worried about, or I thought and I prayed for coworkers, but then I thought about you looking into the eyes of the family or the patient themselves and the tremendous fear they must have had. And can you tell us anything about what you experienced looking into the eyes of that great fear?
We're in an interesting time with this because, like you said, of course, the families can't be there. And you have some of these patients that have been the sickest they've ever been in their entire lives. And they have to go through it, not necessarily alone, but without that physical, visual support and emotional support from their families. So the role of a nurse, I mean, we wear so many hats, but especially now, we almost kind of have to wear that hat of being that emotional family support. And so it really just does take that constant reassurance that we're there for you. We're always going to be there for you, whether your family's there or not. And fortunately too, we've been able to implement different tools. Thank goodness we do live in an age of technology where we can utilize like tablets and allow them to video conference or Zoom call like we're doing right now.
Yeah.
I think a lot of families understand the time that we're in, and even though it's challenging, they do understand.
I teach people breathing, I teach them meditation and yoga and Tai Chi and drinking herbal tea. This is coffee this afternoon. But, were there particular things that helped to balance or help you to self-care, Patrick?
Because of the pandemic, you can't necessarily decompress the ways that you normally would have. You at least certain times couldn't go out and just do some retail therapy, or you couldn't go get a massage, or you couldn't go out to eat, or you couldn't have a beverage, or you couldn't go see your friends. So Um, I think for me personally, it just took a lot of really feeling comfortable coming home and then just enjoying that time by myself. Maybe taking some time to reflect on the day, but then also taking some time to just kind of leave it behind. I really love music. Music has always been very, very, very important to me. And so there have been multiple single jam sessions just with me and my dog at my house just to kind of escape some of that. Actually, I see some plants behind you right there hanging on the
Yeah,
wall.
yeah.
I do have some coworkers who are really, really, really into plants. I'm going to shout out my friend Bree and my friend Mariah, who kind of got me into engaging in some of the house plants. So I have a collection upstairs that I'm starting to grow too. And surprisingly enough, it really is. They really are strangely therapeutic.
Well, you mentioned plants and you mentioned your dog, and I want to give a shout out to your dog because I think dogs are great anchors. You know, nurses provide so much tangible, concrete IVs and drips and all sorts of things, but it's hope that we disseminate, and sometimes we don't even think about it from that perspective, that we're vessels of hope.
There was actually a husband and wife on my unit that I was fortunately able to be a part of their care as well. And they've actually shared their story. It was their daughter that actually took a journal, like a diary of the entire experience that they had from the moment of them starting to not feel well to them being in the hospital to them fortunately actually making it home.
I think that message is great as far as the reciprocity of hope, that you instill hope. And
Mhm.
then when you have an outcome like that, that gives you hope to
Mhm.
continue the journey, because this has had to be hard. Patrick, you're a young man, a young nurse, and I appreciate your wisdom. You know, on the sidelines, we worried about all of those essential workers inside and outside the hospital systems. And so I want to just thank you personally, and I appreciate. Do you have any other wisdoms or thoughts as we move towards closure today?
As hard as it's been, especially being there on the front line, so to speak, we have had that outpouring from the community, from people like you, from fellow coworkers, friends, families, strangers, patients' families that just are giving constant support. I hope to never have to see you or your loved one on my unit, but if they are there, just know, of course, that they're in excellent hands, and we're going to do everything in our power to take care of them. And once again, just thank you so much for everything that you and the community have done to support us here at Parkview. It's been a very, very challenging journey, and it continues to be. But again, just take it day by day, and we always make it through.
Thanks a lot, Patrick. I really appreciate your words today. Have a great.
Thank you, Dave. Thanks.
Uh-huh. Peace.